things that you can ask during the first consultation is the specifics of how the surgery is done, how often it's done, is it generally a successful surgery, what's the time frame that I'm out of work, out of play, how much rehab is involved. So those are the simple things you can ask. What are the general risks of a surgical procedure? Secondarily, you're going to get home and get all this input and have other questions that come up, and you've already left the doctor's office and you're scheduled for surgery in a week, and you get uncomfortable with it. The best thing is to approach that surgeon again, and that can be done sometimes easily on the telephone if it's a few simple questions, and a lot of times my nurse can answer these questions, but I certainly can. Sometimes a patient comes back in and has a second office visit, and what I would recommend is writing everything down on a piece of paper before you come into the office, because then you don't forget something. Because if you just rely on your brain, you get frazzled. You walk out the door and you go, forget that last important question. So write it all down, and feel free to ask your doctor or doctor's nurse or anybody in the OR crew or anesthesia crew your questions or your concerns, because that's what we're there for.